Hi, everybody. It's Hartley Logic here with Ultradent Products. I am here with two very special guests, and one of them in particular looks like he's working in the office right now. Dr. Graham, say hello.
Welcome. Nice to be here, Hartley.
And then Dr. Kamner seems to be on a Hawaiian vacation right now. Say hello.
Wishful thinking. How are everybody doing?
We are here to discuss some virtual seminars coming up. I know that you've seen some posts happen, and we have a really awesome one coming with these two guys. So do you guys want to take it away? What is this course going to be on?
You want to start, Ron, or do you want me to?
Well, you know what? Before we start, let's talk about essential services. And one of the most essential services I think that every governor has deemed has been liquor stores. And I want to know, what have you been imbibing over the last 2 months? Because we all know the stress of not working for most of us has been difficult, and a little bit of alcohol here and there, enjoying and just trying to bring some light into our lives with a cocktail or a glass here or there is important. So what have you been imbibing for the last couple of months?
Are you asking me or Hartley?
Let's ask Hartley first.
I think we should interview Hartley. Yeah.
I should interview me as well. So I feel like my go-to right now, and I gotta tell you the truth, these aren't available everywhere. I did drive to another state to get these, but it's the watermelon White Claw. It's like a seltzer water. It's low calorie. You know, we're trapped inside. I'm not really going to the gym, so I'm trying to work on my figure and drink my alcohol at the same time.
Nice.
Yeah, Ron, I would just say the fact of home isolation has been really quite unique. So I think it's allowed me to re-understand the time of 5 o'clock every night. No doubt about it. I think you would agree.
Which 5 o'clock do you go by? Do you go by Ron's or mine?
I go by the weekend is a different 5 o'clock than the weekday 5 o'clock, Hartley. That's how I look at it.
I get it. For me, interestingly enough, I've really gotten away from much of my hard alcohol and have stuck true to my Instagram name. Don't, Hartley, relax. I've been drinking plenty. It's just I separate my alcohol to hard alcohol and wine. So I've stuck to my Instagram name of Vino Dentino, where I share a lot of Napa information and dental concepts. And I've been drinking plenty of wine and exploring new wine regions as well. So I'm having fun with that over these last 2 months. And that's been exciting.
The course.
And that's it.
So
that's what we're going to talk about.
So I think Hartley, as we dive into the course next week, I think openly this has probably been the most stressful time, all candor, I have been in dentistry. And when I say stress, I've been practicing 30 plus years at this point. I've gone through major, I would say, viral outbreaks, including HIV. And I would say there's been so much unknown that has gone on that, and they're still unknown. Why do some young people get sick and the majority don't? How much is genetic? How much isn't? Should we be doing antibody testing? Shouldn't we? Who's legislating any of this? I mean, yesterday my governor said we could go back to work. We should go back to work. And today he just announced emergency only dentistry. How can we go back and do a lot of dentistry when there's no PPE? Because rightfully so, it's gone to the front lines.
Right.
And you want to cover your team, you want to cover your patients. That's what we're going to be talking about. And I'm telling you, I'm running a series called The New Norm, and I have learned so much, but I'm also witness to so many people who are trying to figure out what should we be doing. Ron?
Yeah, there's a lot of uncertainty right now.
Yeah.
Yeah, I think a big part of our theme when we talk logistics will be mitigation of risk. How do we mitigate risk going forward for ourselves, our team, and our patients? There's been so much misinformation thrown out there. There's been a lot of information that's flat out scary to many people, especially our hygienists. And, you know, there's been a lot of misinformation, putting the fear of God into them to the point where they're going to have to make a decision. Hey, I'm coming back to work, or I'm not, or I'm going to retire, because they've been scared. We're going to try to navigate that and ease the pain, so to speak, for a lot of dentists and a lot of hygiene team as well.
Yeah. So are you guys big on social media? Have you seen what the French dentists are doing right now?
I did see something.
This is not the time, Dr. Graham.
I did see that. I did see that. Yes. Well, you know, French can get away with it, right? Because it's culturally they can do all that.
It's true.
We'll keep our clothes on during our program. How's that? We'll promise you that one.
I feel like that would be definitely approved, Melanie Jones.
So even more to the point, when are hygienists comfortable going back? When are doctors? What's our protocols? What are we going to be doing when we get back? I'll give you just some thoughts. So, for example, we've been talking temperatures. Everybody take your temperature. But 40 to 50% of the time people they could have the virus and they're not going to have an abnormal temperature. One of the things, you know, and Ron and I talk every day, here's a tip for everybody. I think everybody should own a pulse oximeter. And when patients come in, we have a vigorous, and we'll go through this on the Ultradent format when we do this, the presentation. After we go through a written questionnaire, my team will go through a verbal or teledentistry questionnaire and then review each patient with the doctor. And are they a low-risk patient, medium or high-risk patient? And then what's your screening? And I think we should be measuring everybody's oxygen saturation. What they're finding is that people are walking around with COVID, don't know it, and their oxygen saturation is really significantly lower than normal. So there's another opportunity for us to diagnose patients, send them to the doctor, and not see them as a patient because they could be having active COVID.
Right.
So I think there's a lot of unknown, like I started. So I think we'll add a lot in our screening process, and Ron and I will go back and forth on testing because we believe in testing, and there are a lot of dentists who don't want to. And yet the ADA, Ron, it just came out, AGD, they want us testing if we want to test.
Well, I think about the hygiene side of this, and I know that some offices that I worked in before Ultradent I have 45 minutes to see my patients, 50 minutes in one office, 60 minutes is the normal. We're taking blood pressures. Now we're kind of upping that. So it's more stuff for you to do, but it's important. We need to do this, and we have to make time for this. If I don't get to find out what happened during your vacation, that's got to be what we're focusing on, is more of your health and kind of where your protocols are right now. Don't you think?
100%. You know, even before this, Kaiser Medical in California, ProHealth in New York, amongst others, started creating these big medical dental centers. Why? Because they value the extension of dentistry as another specialty of medicine and looking at everything from a systemic perspective. This is just going to tie things in even further, and importantly so, and maybe change the course of direction of dentistry going forward, where every dentist, not just the ones that want to, will have to practice within a systemic model and do many of these testings. Now, the tricky part, is we'll discuss, and I'll pass this to Lou, is that state laws are going to determine what we can and can't do. And that's going to be a little bit tricky to a certain extent. But at some point, we took an oath to take care of our patients and do the best we can without doing any harm. And I think that's what this is about.
Yep.
How do we do the best we can do without doing any harm? Lou, your thought?
I think dentistry as a profession that we are mandated state by state has made this even a bigger mess, because what Pennsylvania wants and what Utah wants is different than New York or Illinois. And I'm telling you, that's all wrong. I mean, it's been wrong in my eyes for years. There should be a standard of care for dentistry of how I practice. You know, for example, you have a great laser. Ron and I are both laser people. We both love the Gemini, but we've been lasering for years. Why should some states mandate more restrictions than others. I don't understand it. If someone is trained to use lasers, what difference does it make what state they're in? The same thing goes, for example, if a state mandates that we can't do something, what are we supposed to do? My feeling is that I'm going to do what's best for my patients. So one of the things we did was, Ron and I are very big Weave users, and we used Weave to text out, like a text from me to my patients, and I did a video. And the video was 2 minutes of what you can expect when you come back to my office. So there was a link from Weave over. It's amazing how many of my patients felt better and texted or emailed the office and going, we miss you, we understand, we're with you, let's all be safe. This is what we need to be doing in dentistry. The laws are the laws. It kind of gets me crazy, but I think, look, you come from an Ultradent foundation. Ron and I love the Dan, the Jelena. We love the whole idea of what the company espouses now under Dirk's leadership and the team's leadership. This is what we should all be about: practicing safely, still doing the best dentistry we can. Ron, I think that's what this is all about.
And Hartley, to your question, what's going to happen next week? Well, yeah, we're going to talk about all these things. We're going to be the ones stepping out on the plank a little bit and say, gang, here are things you should think about as you open the doors going forward. And even before you open the doors, right now, Here are things that you need to do to your infrastructure to create positive change, because we all have dead time right now. So what I did today, for example, I worked on our website, and it's a work in progress. I deleted some stuff. I added some stuff. I added some information. I'm going to continue to build the infrastructure so when we are ready to go back, we're ready to go. So for the viewers on now, here's your to-do between now and next week. Critically look at your website, both on a computer and on a cell phone. See if you're mobile ready. Speak to your web provider, change content. If you're like me, you probably have a staff member on there that might have left 6 months ago that you didn't change out or move out. Clean things up, get new pictures, new headshots for your team, add information, and become current. Because every way you practice in January of 2020 is going to totally change when you go back in May and in June 2020. So now is the time to build that infrastructure. And these are the kind of things we're going to talk about. I gave away one little tip right now, Hartley. That's the website. Everyone can get on their websites and get those taken care of.
Yeah, and that's a great way to start. And then along with that, jump on social media, do what we're doing now. I know that you guys can actually post this to your actual patient pages, and maybe not everybody's going to understand the information that's in it, but they're going to see that you guys are learning and you're educating people and you're figuring out a better way to protect those patients, because most of our patients get their information off of Facebook. And that's not always the best place. When I say not always, I mean it's not ever the best place, except for this.
And the big problem, I think, and Lou mentioned this, we don't know. The doctors don't know. Mm-mm. Fauci doesn't really, they don't know. They think they know. We're guided by certain things, and then a week later, things change a little bit. So someone may post something on a group at Facebook, and the first thing you got to do is look at the date. And if it's March 25th, I can tell you the information is not accurate right now because things have changed dramatically since March 25th. So accurate information is hard to come by. I know Lou and I, we're constantly texting and emailing each other an article or a text from a piece or somewhere. Hey, look at this, research this. What do you think of this? Because we want to disseminate accurate information to our colleagues, both doctors and hygienists. That is the goal. The way we're going to practice, we'd like everybody else to practice in that same mind frame of within their practice constraints, but at least get everybody thinking that way. Wouldn't you say, Lou?
Yeah, Hartley, every week, every Tuesday, we have a Zoom team meeting. And all my team comes on, and we're talking about, for example, when people come back, in addition to, let's just say, your new emergency protocol, your pre-brushing, your pre-this. We go through all that, And now we're also instituting potentially, how do we want to finance these patients when they come back? What would be the best way? What's the best company to work with? What's the best dental plan? So we have a big in-office dental plan. What are we going to offer our patients when they come back? I mean, in Chicago, you've got to look at unemployed patients. Thank God they're not going to have any more PPOs. And I think this is the time to get off PPOs. I'm sorry, unless, and I'll say this, unless Delta Dental and MetLife, and I know I'm Facebook Live and I don't care, unless these companies start sharing what their intake is and start sharing with the offices, A, raising our fees, and B, compensating us for our PPEs. It's going to cost us $25 to $45 PPE costs. If one of these companies pays me $10, what are they telling me? I should use cheap PPEs. So the way I look at this is a transformation type of opportunity in dentistry. Terrible thing that's going on. How do you want to grow? Do you want to grow safe and do you want to prosper, or do you want to continue to be what you've been doing and to work like you have? You're not going to be able to work like you have given what's going on in just the setup in PPE alone. I think this is an unbelievable opportunity to figure out with your team how you go forward.
Yeah, well, along with that, it changes daily. So like my husband actually had a dental cleaning appointment today and he got a text on Friday. Hey, actually, we have to cancel this. They were going to be open today. Now they're kind of saying next week. And then I'm a hygienist and I'm in a group text message, and there's a lot. I would say that 50% of those girls, they're afraid to go back to work. And it's not that they're afraid to treat patients, because like you said, Dr. Kamner, do no harm. That is something that we have to go back to work. Perio doesn't stop, decay doesn't stop, emergencies don't stop, but everything else can turn into an emergency, right? Where it's one of those things they're afraid because of the PPE, and is there enough for us right now?
You know, listen, going forward, we know there is going to be a different set of risks. You will see next week, after we talk about all the things we're going to do, yep, I'm going to try to break it down a little bit. And I believe once we're going back, that risk will be a small risk once we break it down. But yes, there'll be a risk. As long as all the other things that we discuss next week are adhered to pretty well, or some form of it, I believe, and we have the PPE, which of course we can't go to work without it. I believe that risk is going to be about as low as can be. Impossible? No. Zero? No. But very low? Yes. And don't forget, and this is part of what we'll discuss, every week, every day, the prevalence will go down little by little by little. All of that will work in our favor. In different states, it may take different times. But here in New York, where we've been hit hardest than anywhere else in the country, we're starting to see the prevalence get lower and lower. It's going to take time, but because I can attest to the fact, living in a state, downstate New York, where it's basically like a war zone. Mm-hmm. It's been like a war zone. There's no question. Yeah. So, I mean, but we'll talk about these things, and we'll talk about how are we going to minimize that risk, Lou?
And I think Ron's partly right. And also, I'll go another direction. Okay. I think Ron has been in the hell zone. He's been in the hell zone. Ron, how many patients of yours have died?
A number of patients, family, and a number are still in the hospital.
Yeah.
That I know of.
Right, and I don't know, but I'm telling you, he's been in the war zone. But I think here's what we have to be thinking. The prevalence is going to come back. Everybody said this, whether it's Brad Pitt as Fauci or Fauci as Brad Pitt, there's no question the prevalence, we're going to have another peak. I mean, It's as clear. So the more protocols we have in place, the more safety we have in place, the better we will be as a profession. We don't want to add to the prevalence by cross-infecting. We want to minimize that. That's the most important thing that we can transfer to our patients, is confidence that we're doing everything we can. And that's been really kind of the cluster. What is everything that we can? So openly, Hygienists are going to need X, Y, and Z before they go back to work, no matter what. No matter what. And dentists are going to need X, Y, and Z, no matter what, along with their assistants and front team. That's what we got to get through. I mean, one little pearl could be, why wouldn't we be using, for example, Zoom Go at a 10%? I mean, Ron and I have talked about this. We're pre-rinsing with a hydrogen peroxide. Why not potentially, I mean, I interviewed Perio Protect and it's brilliant stuff. Why not do a Zoom Go for 5 minutes, or before the patient comes in, let them do it at home for a day or two or the morning of, and then brush your teeth right afterwards. The peroxide itself is so, what I would call, it is one of the best disinfectants we can get to. I mean, I'm not talking federal disinfectant, but I'm saying we can disinfect our mouths. That should be part of the aim of pre-treatment, and I really mean that.
Are you meaning adolescents go, Dr. Graham?
Yes, I'm not saying you should go. I'm meaning opalescents go. I mean, if you have a peroxide in your mouth for 3 minutes, take it out, brush with it. After you've rinsed, think about the therapeutic effect of minimizing cross-contamination. I mean, this is the kind of stuff, it's right out of, it's really the stuff that we all know how to use. We're just using things differently.
Yeah, true.
You know, it's interesting. And I'll say it now, so I'll burst a little bit of the bubble next week. But certain of the Ultradent products, and Lou just mentioned one, will really come into play now to minimize issues. Think of the Ultra Pro Prophy Angles, the new Prophy Angles where you have little to no splatter. How important those Ultra Pro Prophy Angles will now come into play, trying to minimize, you as a hygienist can really appreciate no splatter or virtually no splatter of that prophy paste. And there's some others. I'll get to others next week, but that's a couple of little teasers. Look at those prophy angles now and think, and really, I've seen the video. I show the video in my lectures. Watch that video of how the prophy paste stays on the tooth and in contact with that prophy angle and doesn't splatter out and into the aerosol. How important is that during this time?
So critical. So critical.
Seriously. My favorite products, that prophy paste and that sweet prophy cup, because no matter what you do, when you have that teenage hormonal saliva, it's flipping around, just flies out, that sweet little brush, it's going to help protect you.
So all these kind of things are all, and we'll talk more about some other things, but we're going to lead into, so getting back to next week when we do this, we're going to talk protocol, we're going to talk the office, we're going to talk a couple of product stuff, little niche stuff that, hey, if you did this or did this, this could help or minimize. And we're going to just, every attendee, and I hope you guys really draw full capacity, because every attendee is going to walk away with a checklist of pearls. And I'm warning you, all of you, for those that are attending, bring a notebook, bring a pen, because you will be writing the entire time. When Lou and I get together and we get going, it gets scary.
True. Just kidding.
Now, do we have 4 hours or 6?
Today?
No.
We're talking about May 4th. That's when your virtual seminar is going to be coming out.
May 4th.
Okay. Yeah.
All right. Everybody who's currently watching right now, by the way, feel free to ask any questions. Ron and Lou, it looks like we have a lot of people who are saying, yes, sweep is crucial. 100% agree on different protocols. Someone said scary is good. I'm going to agree scary is good, but I'm also going to say scary is scary, and that's okay to be scared, because this is why we're medical professionals. We came into dentistry to solve problems, and that's what we like to do. Right, guys?
100%. No question. No question, 100%.
So I will be dropping in the chat the registration for the virtual course that's going to be on again May 4th. It's going to be going over some of the topics that we talked about today, COVID-19, treating with your treatment planning, and then also going with your hygienist. But I do have another question. What is your guys' favorite Ultradent product that you can talk about right now that will help people prevent the spread, is what I want to say?
I'll go first. So I started. Let's talk Ultra Pro Sweep, right? I mean, that Profi angle is going to be huge, and that's going to be one. You know, I'll go back to what I said a few minutes ago. Every Facebook board or thread that I see hygienists on, I will tell you 70% of the information is scary and negative.
Yeah.
They're either going back to work or they're not. Now, my hygienists are going back to work, and they're going to be made to feel more comfortable with all the things we're doing. And once we've incorporated the Ultra Pro Suite, and we do, and they go back to that, and I remind them, say, remember, no splatter with this, they're going to feel an additional comfort level that that saliva is not going to spread. So I think that particular product, while it's been out for a while, and it was meant to eliminate that splatter and keep the Profi paste on. Who knew in advance this spread of things would be so critical? It's so fitting right now as a product. As for those that have not seen it or tried it, I know you guys, and I'm going to market you guys here. I know you guys are trying to help dentists with some very aggressive pricing to try to get dentists going again. Here, take my word on this, gang. The Ultra Pro, the Profi angles, the sweep are special. Get as many as you can.
Yep. What about you, Ron? What are you thinking? I mean, Lou. Sorry.
So are you asking as it relates to the COVID? Is that what you're saying?
You know what? I'm going to leave that up to you. I was asking related to COVID-19, but if you have a different product besides the Velo, because we all love the Velo, which one's your go-to?
Yeah, you know, I would say, of course, the Velo is my go-to. It is the go-to. I think Ron and I would absolutely. To me, it's like, I don't know. It's the landmark product of Ultradent. That's or whatever. It's that. I would say, in my everyday clinical practice going forth with COVID, I would say one of two products. Obviously, I think for hygiene, your laser becomes tremendously important. We got to find out about the plume effect, because the plume effect is something I am concerned about, and it may be nothing. But again, I just don't know virus plume effect. I would tell you my favorite everyday product is your rubber dam. I love your rubber dam. I know. You got to understand, if you're not using Isolite or Dry Shield or one of these type of products, and we have them in my practice, but sometimes I just need to pop on a rubber dam, and I use a lot of rubber dams. I know it sounds like I'm old fashioned, but it doesn't tear, and I don't have to, it just doesn't tear. It stretches, and it's the easiest thing in the world. And I would say for every day, that's my everyday favorite. And I know it's not like, you know, everybody's going to talk about it, but I'm going to say it's the unsung hero. It's an unsung hero.
Yep.
And we'll talk lasers next week, so that's going to be fun. We'll save that for next week.
Yeah.
We'll save the talk on lasers. Looks like we have some people commenting in. It says all dentists should get off PPO plans now. You are short changing yourselves and our profession as a whole, in my honest opinion. So definitely agreeing with you.
Let me just say, I hate them. I have hated them. I'm in their face wherever I can, whenever I present. And in all honesty, I feel like dentistry is a hard profession. You know, I look at what Dan Fisher has done, now what Jelena has done, and they would tell you, as rewarding as dentistry is, it's hard to do. So is a full day of hygiene. Now, you put on an N95 mask and work 6 hours. Oh my God, you're talking about even a harder day. Why should I do anything at a discount? I'd rather finance my patients on my own fees that make it affordable for my patients than have PPOs dictate what fees I should be charging. I just don't get it. And whoever just commented on that as a question, this is the exact time, because you're going to be seeing fewer patients. How are you going to rebuild your office or grow it again? It's not PPO. And unless the PPOs really figure out how to compensate us in a fair manner, I tell dentists, start thinking forward and don't go back to the old way. Ron?
Listen, I totally get it. These are the things that are going to start to change. And one of the things that you're going to see is that for those that are working with PPOs, it's going to be tight. We have some PPOs in the office, and we're already talking about getting off because the numbers are going to get tight. You're not going to be able to do the dentistry, like you say, with all the PPE and not be compensated and make a living, to be very honest.
Yep.
So that's totally going to change. There's no question about it.
Agreed wholeheartedly. Even as a hygienist, since I'm not a doctor owner, I just kind of go in and do my thing and take care of my patients. This is a different world for us compared to you guys. And I appreciate you being honest and saying the hard thing. You know, we don't like PPOs, and you know you were on a Facebook Live, but that's what this is about. It's about being authentic, and it's about all of us coming together. If everybody band together against PPOs, things would be different, especially with PPE. So good job on you. Super proud.
Yeah.
Let me throw two more little tips because we have people that are on today. All right. Two, and people may have done this already. Totally unrelated. Well, some of it unrelated to dentistry, but call your malpractice carrier. Ask them for a part-time practice discount. Tell them you want it retro to March 20th. All the carriers are offering refunds or discounts to the dentists, and you just got to fill out a form and they'll do that because we haven't been working. So that'll save you a couple dollars right away.
That's good to know. Definitely going to drop that in the comments. You said retro to March 20th?
Well, that's depending when most states stop. In New York, it was March 20th. So depending when you stop, they're going to retro. The other thing is call your car insurance company. They're also giving discounts to part-time drivers because people aren't going as far. So as a matter of fact, mine is Geico. And when I call them, they automatically said that every Geico customer is getting a discount for this quarter. I didn't have to talk to somebody. But check with your insurance companies and you can generate some discounts, put some money back in your pocket. Those are two tips that you got today.
That's awesome. I'm going to call Geico because I also am with them today.
There you go.
And I noticed that, Dr. Lee, you're no longer practicing right now. Looks like you wrapped that patient up. You have a different background.
Back home. Yeah. Yeah.
It was a quick drive.
Yeah.
We have one more comment that disagreed with you again with the filtrant and the suction will assist in reducing flume from the laser use. I know that I've seen a lot of talk in the dental groups about different suctioning. As a hygienist, I'm going to talk about ultrasonic. You guys are going to talk about something different, but do you guys have any advice on suctioning right now? I've seen like the cups, I've seen Isolite, I've seen just the regular saliva injector. Sorry, no. You know, what is your advice on that for right now?
So I'll start. And what I do love about Ultradent, and Ron and I have, you know, the Ultradent family has just been unbelievable. And really, they're all about doing what's right in dentistry. So I feel pretty open about everything when I'm presenting for Ultradent. So Dentsply has a system for hygienists, and it's called PureVac. And it's been around 2 years, and nobody's used it. I won't say nobody's used it, but it's really not been Hartley the biggest winner. This will be one of the biggest winners in the COVID era, if you ask me. And what it is it's a high vac suction with a really bendable tube, and your suction piece at the end of it has a mirror. So instead of you holding a mirror as a hygienist, when you do ultrasonics, and I'm going to minimize ultrasonics initially in my office until I have the proper suction. This can eliminate, per their studies, 90% of the aerosol. So if you concentrated close enough, think about if the hygienist is wearing a face shield, an N95 mask, and using a high-speed suction with a mirror on it, I think this is the kind of stuff that I think will allow us to practice safer. These are the kind of products. And again, I think being open on Facebook, I think dentistry is full of great companies. And I think that's the kind of product, one of many, that's wonderful for us to know about. Ron?
Yeah, I totally agree. I think that, and I don't want to burst our bubble for May 4th, so I'm not going to give it all away. But what I will say is that there's been a lot of hype of a lot of different products out there, and people are making emotional decisions as people do. So, and I think that everyone needs to just take a step back a little bit and realize that emotional decisions will only get you into spending a lot of money, sometimes may not be the solution to the answers. And we'll talk about niche products like what Lou just said, the PureVac. And I got a couple others up my sleeve that I don't want to give away yet. But on May 4th, things that we believe will make more logical sense. Because a lot of this is, if you started breaking things down, and for me, it's about breaking things down to the fine points, it's what makes sense. Because nobody will tell you that if you use an external suction, you're guaranteed to lift off this much of the aerosol, or that external suction is going to do X. I'm not saying they're good, bad, or indifferent yet. What I'm saying is people are preying on dentists and creating shortages of supply, saying, well, you can't get this, you better order it now. And at the end of the day, many of these things that are costing a lot of money that are external, likely within 6 months won't be used anymore, but they could be things like a PureVac and some other things that Lou said that will become part of day-to-day hygiene protocol that they'll use forever. Because not only will it do what it's doing, but it's going to make their life a lot easier. So, and again, I'll just throw, and the rest we'll save for May 4th, one of the things many people have gone out to purchase the external suctions. And I just want to throw, before any others waste their money, notice here what I said, that suction's got to be pretty darn close to the mouth in order for it to grab the aerosol. Yeah. The closer you get to the mouth, the harder it is to do forehand dentistry, to do other things. So just you got to be logical with these things before we jump to do it. I have a couple of other tricks, like I said, and ideas that I'll share, but I'll wait till May 4th to do it.
That makes me feel like you just kind of answered this question that we got on here that said, are you going to be talking about ventilation? And that is a yes, right?
You will, 100%.
Yep.
Definitely. We have Gerwick that says he agrees with us on the insurance companies. They are barely going to increase fees. Thank you so much for agreeing with us. We have another comment for you, Dr. Lou Graham. It says, what are your thoughts about Governor? Maybe we shouldn't go into this one, but I'm going to finish reading this question. What do you think about the governor stating that Illinois dentists can go back to work today?
So this goes back into the whole political and what's been going on. Yeah. So openly.
Switzerland.
Okay. We're always Switzerland, okay?
You know what? One of the things I love about, one of the many things I love about, I'll just say this company and Dan Fisher is he walks the walk and opinions are, and you can't be shy on your opinions. You know, it's all about caring. And JB, that's our governor, rightfully so closed us down March 16th, I believe our date was. I closed a week before that. Yesterday or Friday when somebody asked him, should dentists go back to work? He said, yeah, go back to work. I don't think, honestly, I don't think he was well informed of it. It was just not the right thing to say. And today he went and reversed himself and said openly, emergency only. So I'm just going to say this, whether it's JB or Cuomo or whoever, putting all the politics aside, we need PPE to go back to work. And I'm sorry, I look at all this crappy stuff on social media about, are you ready to go back to work regardless? And I'm not ready to go back to work regardless, because it only takes one sick patient to infect my team, and then I infect a lot of other people. So that's the reality of it. And I think once I have the proper PPE and the proper protocols, I'm ready to go back to work. I agree with Ron. I don't live in fear. I just need the right equipment in order to do this. And that's the right answer for everybody. And people want to go back to work without the right protection. I just think you're 3 weeks or 4 weeks too early. Or if you've got emergencies and you got PPE, take care of these people who need it. I've got 6 patients next Tuesday. I'm taking care of all my patients, of course. But I got the right equipment at least to safeguard my safety right now.
Yep, agreed. So agreeing with you, that is next week, May the 4th be with you, AKA May 4th is when this is gonna come out. We're going to talk everything COVID-19, products, protocols, what to do, what not to do. We're not only going to talk about Ultradent products, what we just kind of hinted on right there. And also, you are watching the Ultradent page, so you know we are going to talk about that. And as Ultradent, we are offering 40% discount on all of our emergency products, including our opalescence whitening right now. We're trying to do something to help you out as much as we can, and hopefully that will be one of those things. Any last words, guys?
This was fun.
Yeah, Ron and I like sharing. We just like sharing information together. You won't be bored, and there'll be a ton of stuff to come out of it. We're two practicing dentists. We get it.
Yeah, you're real. You're in the chair. You have a team, and you've got to solve these problems. And what better way to solve them when you have to, right?
100%.
Awesome. Well, everybody, it was great talking to you again. Also, if you want to tune in on our Instagram page, we might be having one of these guys as a guest soon. Tomorrow, we're going to have Dr. Bioki from Brazil come on and talk to us about some restorative work stuff and maybe our chairside guide if you're interested in that. So follow us at Ultradent Products on Instagram. And then I know you're watching this on Facebook, but it is at Ultradent. Other than that, you guys have a great rest of your day, and we'll see you on May the 4th be with you.
Thanks, Hartley. Bye, everybody.
Thank you.